to go to see family for a weekend. So helping patients to improve their quality of life, understanding the mechanisms behind the symptoms, providing a tailored treatment that help those symptoms is a privilege, and I'm really thankful to be able to provide that type of care.
Perfect. Such a good answer, and we can just use that. That would be your entire video. That worked really nicely. But I'm going to go through some of the details.
Yeah, sure.
Can you tell me how you decided to specialise in this area? Take us back to when you made those decisions.
Okay, so I'm very interested in, one of the reasons why I like medicine so much is because it's very interesting from an academic point of view, from an intellectual point of view. It's a real challenge, and you are surrounded by colleagues that are incredibly smart, and you can constantly learn from them. At the same time, being a doctor allows you to help patients, to help them in their daily lives, to apply that knowledge to people of different social backgrounds, economical backgrounds. Is a real privilege. And with gastroenterology in particular, we are dealing with symptoms that most patients experience, most of us actually experience on a daily basis. Lots of us experience heartburn every now and then, or bloating every now and then. So they are not rare symptoms. It gives me the opportunity to help a vast majority of people, and also with new technologies that Cleveland.
Take it back to, and also with new technologies
that is Cleveland Clinic London.
You got it.
With the new technologies that Cleveland Clinic London is going to be able to, it's not going to.
Yeah. Just start with and as well.
And with the new technologies that Cleveland Clinic London is able to offer, we can understand the mechanisms behind those symptoms. We can interpret those symptoms, and we can also offer a tailored treatment that adapts to the particular circumstances of that patient. And the beauty behind my specialty is that we are not as maybe prescriptive as others. We might be able to treat symptoms with drugs, with certain medications, but also at the same time we can help with dietetic intervention that might be more suitable for certain people, or we can involve rehabilitation techniques that can also be very helpful. So it's a partnership. It's a specialty that allows us to have a partnership with the patient and work with the patient on a therapeutic pathway that suits the patient needs. And I think this is a fantastic opportunity for us as doctors. We are in a new type of medicine. We are not in a paternalistic medicine where we decide what the patient should be taking. We are in a new medicine where we work together and we adapt our knowledge to what the patient needs, and the patient feels is appropriate for their lifestyle or for their circumstances. It's fantastic.
Perfect. Such good quotes. These are really, really, really
very passionate.
Yeah, and that's what patients want to see. So now maybe you can drill down into one. I mean, I think you were talking about sort of tailored treatment. There was one area that obviously excites you. Have you got any other areas of treatment that are particularly kind of going there?
Yeah, there's also one important aspect of my specialty that I really like, and it's that, as you can imagine, there are a number of conditions that are not per se gastroenterology disorders that actually influence the function of the gut. So patients, for example, who have conditions like diabetes mellitus, or who have neurological disorders, spine injuries, all those conditions are going to affect the way the gut functions and works. And this is another area of interest for me. And in neurogastroenterology, we have the expertise, the test, the technology to be able to understand how those conditions affect the gut. And one of the fantastic aspects of working in Cleveland Clinic London is that this is an institution where we are going to be working not in isolation. We're going to be working together with other colleagues, and we can provide that joint care that will focus not on a particular problem, but on the whole patient, on the patient needs from an integrated perspective.
That's really helpful. I think we should cover some of that again, because I think we were talking a little bit in future tense there, where you're talking a little bit about we will work in partnership, things like that. I think if you say we are working, we do work in partnership, that's a little bit more helpful. So tell us a little bit about why you're excited about like a multidisciplinary approach or a team approach.
So one of the fundamental difference between Cleveland Clinic London and other institutions is that we are working in partnership. We are not isolated consultants seeing patients for a particular problem and working on our own. We are able to provide coordinated care. In fact, this is an institution that's going to provide multidisciplinary team discussions. So the best strategy for a patient is going to be decided not just by one individual, it's going to be decided on the basis of the expertise of multiple specialists. That is incredibly safe for the patient. That is very novel in the UK private sector, and that was the fundamental aspect that attracted me to this project. Patients have the best care from different specialists that are working together to provide that support and that care that patients need.
Brilliant. Perfect. You nailed that one. That was absolutely great. So tell me a little bit about what a typical patient interaction looks like. And I think about it from the patient's perspective. What should the patient expect when they come to see you?
Every patient is different. So I can't say that it's a particular model. There are patients that will be concerned about the cause of a particular symptoms, will perform the appropriate investigations, will provide advice. Sorry, let's start. Are.
Yes, you're absolutely right. I think you got away with that one, to be honest. I didn't catch my ear, but let's do it again anyway. Take it from the same point.
So there is not one single approach that works for every patient. There are patients that have symptoms that require investigations. We're able to provide those investigations and provide the appropriate advice on the basis of those investigations. There are patients who actually have chronic conditions, maybe because their gut is not functioning properly, or because there are other systemic factors, as I've mentioned before, that are going to influence on the function of the gut. And with these patients, I will be able, in conjunction with my colleagues, to provide the appropriate investigations, the appropriate tailored treatment, but also follow that up over time. The vast majority of these patients are going to need support over time, and we will need to adjust the treatment and the recommendations according how their clinical circumstances change over time. And they might require frequent reviews, or they might require maybe once per year, twice per year review and adjustment of those therapies. So it depends very much on the underlying condition, the chronicity of that condition, and how those symptoms interplay with other underlying medical problems. Yeah.
Great. I wonder if we can go into even more sort of granular detail, I suppose, there about what happens? They know they've got an appointment with you. Do they come and meet you at their office? What happens after that? Maybe just talk them through a consultation.
Yeah. So when patients come to my clinic, and the first thing they're going to expect is a long consultation. I'm going to go in detail through their medical symptoms, their medical history, previous investigations or tests that they have had, and previous treatments that they might have tried. Then I will propose a diagnostic strategy and a therapeutic strategy. And that diagnostic strategy will depend on the patient preference, in the sense that, of course, there are tests that are fundamental because we want to rule out a difficult condition or a concerning condition, but there will be tests that will help us to understand the mechanisms behind those symptoms. I'm a firm believer that the patient has to have a voice in deciding if those tests are appropriate and needed. They are always needed, but if they are appropriate for the patient. We doctors sometimes forget how scary it can be to come to the hospital, and that some of the tests that we do might not be that nice, even if all the staff at the Cleveland Clinic London are going to providing a phenomenal care. And it's very important that I explain to the patients the rationale for those tests, the benefits of doing those tests, but also hearing the patient's voice and making sure that the patient